Welcome, everybody, to our April Health Innovation Community Partnership meeting. We're going to go ahead and get started this morning. We know today is kind of a busy day for a lot of people. It's spring break, and so we actually have a shorter agenda than we typically do. So we anticipate our meeting may run for about an hour to an hour and 15 minutes. So it should be nice and tight today, and it looks like we will be ending a little bit early. But let's go ahead and get started and take a look at what we will be hearing later this morning. As always, we ask you to please mute your microphone unless speaking, but enable your camera if possible so we can see your lovely faces. And then, of course, our meeting is interpreted. It does provide language interpretation into Spanish. So we invite you to select via the globe at the bottom of your screen, English or Spanish as you prefer. And then please note that this meeting is being recorded. We will be posting the recording for later viewing on our Health Innovation Community Partnership website, which is hicpla.org. So we've already been over the tech tips for the Zoom meetings, but everything you need to know is on the toolbar at the bottom of the screen. Once again, please select the language of your choice. Please raise a hand if you have a question anywhere throughout our meeting. We'll make sure to get back to you. And of course, you're always welcome to leave comments or questions or links in the chat so we can stay connected that way as well. Finally, we also have the option of captions, of closed captioning. So you can select those via the More option to select closed captioning. So today's meeting, what are we going to be going through today? We'll have, as always, an update from our LAC USC Medical Center. We also have a community and campus health update from the Department of Public Health. And we'll be doing a quick little review of where things are at with the General Hospital West Campus. And we'll also be getting a nice update from our partners at the Restorative Care Village Permanent Supportive Housing Project. And that should take us through to about 10:15. To kick us off, I'll go ahead and read our guiding principles, which is the shared agreements created by this body to guide our work together. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious, and seek to understand various points of view. Participants will explain their reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, I'm always excited to welcome the leadership of our LAC USC Medical Center to share some updates with us of things, events and priorities and projects on the campus. So Jorge or Edgar, welcome.
Thank you, Heather. It really is a pleasure to be here this morning. Just a few updates about our medical center. Now, Heather, you have the slides. Next slide. So as the pandemic is winding down, there were a lot of rules and regulations in the medical center that were passed during the pandemic. And one of those is masking. We recently updated our expected practice in our medical center. And essentially, for all workforce members, if you're in a patient care area, you need to wear a mask. If you're not in a patient care area, you don't need to wear a mask. So that's essentially what the change is, because before it used to be anywhere indoors, you needed to wear a mask. Also, it changes for our patients and visitors. It's optional for them to wear a mask or not. And we will be providing masks at the entrance. We will encourage people to wear masks, but the expected practices are less stringent around masking. Our vendors, visitors will also be expected when they're in patient care areas to wear masks. Next slide. So we're getting close to the big reveal of our changing the name of our hospital, of rebranding our hospital, and just wanted to share some of the strategies that we will be employing to make sure that the community knows what this change is, what this change means. So we will be having advertisements put on buses, inside buses, in laundromat, in supermarket, pop panel ads. Next slide, please. We'll have billboards, posters. We're going to send patients a letter notifying them of the change. We'll have a social media campaign, and we'll have on-campus ambassadors and flyers just to let people know of this change. So we have had a few individuals who have set up their tents on Marengo Street right in front of the hospital entrance. And just wanted to provide an update on kind of what we are doing as a medical center to address some of the safety concerns that the community, that our employees have brought up. Now, there's probably about three to four individuals that have set up, and we have an outreach team through Exodus that engages with these individuals, offers housing services. We've also had our clinical teams go out there and offer medical services and clinical services to them. But despite that, we still had some significant concerns. One is one individual was tapping into our electrical grid in the hospital, and which raises a lot of regulatory safety concerns in terms of the stability of our electrical grid there. Next slide. So the other big concern is, you could see here, the walkways are blocked. The walkways are used by our facilities staff as a thoroughfare to deliver equipment, to deliver services. And so that's been quite a challenge for us. So we have engaged with these individuals. I'm happy to report that this morning, we were able to find some temporary housing for two of the individuals, and they have accepted. And so at 9:30 and at 11:30, two of the individuals will be moved into housing. So we're very happy about that. Next. Back to our big renaming event, May 3rd. I want to make sure that all of you are invited to participate in this big reveal. There is an RSVP flyer here, so please link on this and join us for this very exciting event on May 3rd. And with that, and then on May 5th, we're going to have a community event celebrating this rebranding for Cinco de Mayo. And so we want to invite anyone from our community to participate, and the information is listed here in the flyer. So with that, any questions that I might be able to answer?
So any questions for Jorge? Such exciting news, Jorge, about the rebranding. And thank you so much for bringing that message to HICP and inviting our membership to participate in this really, really exciting event. And in correspondence with Cinco de Mayo, that should be a really fun first week of May. Do we have any questions for Jorge about that? You'll note, everyone attending the meeting, that the link to the form has been put in the chat. So if you'd like to RSVP to join, please click through on that link. We'll also make sure we send a follow-on email to everyone after the conclusion of today's meeting with this additional information so that people can take advantage. Do we have any questions for Jorge?
A quick question, Heather.
Yes.
To Jorge, this is Teresa.
Hi, Teresa.
Hey, I really appreciate and really it's good to hear from you how the medical center is supporting, addressing the homeless in the immediate areas on the campus. I know we all know all that it takes to get two people to agree to move, and we can go on and on. It's a very intentional, sometimes slow moving process. And so I appreciate that one. Quick question though, what happens when someone does not agree to move? How is that handled?
Yeah, great question. We have engaged Councilmember De Leon's office because this is on LA City property on the sidewalk. And so they have a team and a process by which they also do some outreach and engagement. And at some point, there is a decision to clear out encampments. I'm not sure exactly how that decision is made, but there is sort of an end point after all services have been offered and so forth. But these individuals have been there for at least a couple of months now, so we'll see. Hopefully.
Hi, this is Monica. I just wanted to say that reality is that there's been a team, an outreach team with Exodus, and actually a team with that work with the hospital, and it's been years before Jorge was CEO. But people are always coming back. It'd be different people. We've held several different people that have been on the campus, but unfortunately more people become homeless, and De Leon's office would reach out to Exodus as well to be able to help. But unfortunately, some people, it's hard for them to get the help and accept the help. There's a lot of, as you know, a lot of reasons why, right? But it's cities, it is a city street, and you can clean it out, but they may come back. So
I just want to remind folks that
things, it's not illegal to be homeless. And
right. We are committed to being part of this solution. I can tell you in our hospital, we have close to 80 individuals who are either unhoused or unstably housed or don't have anywhere to be discharged to. And so these are individuals that don't need to be in the hospital, but unfortunately there are no sort of options for them.
That's why they have the privilege to.
Sorry, Monica, it was a little choppy there, but if you want to try again, I don't know, it seems like your connection may be unstable.
No, I think it's important for people to understand. It's just important for people to understand that it's a long process for some people to accept services for a variety of reasons. And there've been teams, particularly that were funded through whatever, but that are
Yeah, I'm sorry, Monica. We caught most of what you said, but at the very end, it kind of broke up again. I'm sorry. It seems like the connection's just a little unstable. So as you were saying, Jorge, this is a chronic situation that the hospital does contend with, both inside our walls and now outside our walls as well.
Right.
That work just on the campus.
Yeah. So, but I mean, congratulations that two of the individuals, the right accommodation was available to them, that they were able to accept. As Monica is saying,
right?
It's a complex
but
issue.
just know that it becomes homeless, or
Yeah, it's a very complex issue with many like intersecting factors, which is part of the reason our campus has been so deeply invested in the restorative care village development to create that continuum of care model with different levels of step up and step down care to take care of people at different parts of their healing journey. Ari, I see your hand raised.
Yes, thanks. So, you know, my assumption is that they're picking that spot for health or rather safety reasons, you know, maybe thinking, well, this is kind of a safe spot. But what I'm wondering is those, you know, camping, but also behind the hospital over by Lincoln Park, there's a whole row of RV vehicles.
Right.
And so my question is there some sort of an outreach team in terms of making sure that they don't need immediate medical assistance, or at least getting them into the medical assistance process
So,
as a way of getting them to final housing?
Yeah, great question, Adi. You know, this is
so
an issue.
Ari, there is a team that
I'm sorry, Monica, we've lost you again.
can you hear me now?
Yes.
Well, right now I can. Yeah,
Okay,
try.
so I just wanted to say that there are teams that go out. It's again, Exodus is the provider in the area, and they go out to the different areas and outreach. It just, and they go out to that specific row. I mean, there was a whole community on Huntington Drive in El Sereno, and Councilmember De Leon's office, you know, was able to help, you know, because part of the issue is where do you put them? But there was, they took over one of the motels, and most of the people, I would say 98% of the people went into those motels, and that permanent housing for them. But again, it's just, unfortunately, it's a revolving door, not for the people, but one person gets housed, another person becomes homeless. So that's the big issue. And they do, I'm hospital, or maybe they just.
So sorry, Monica, you're
I don't
you
know,
cut
but
out
it's,
again.
there are outreach teams that do go out. And then LASA kind of like oversees, like if people see somebody or they want them to get services or whatever, you can always go through LA HOP, and they'll look.
I'm sorry, Monica, you're
For
still
the
continuing
right
to cut in and
team
out.
to outreach to
Monica,
those
perhaps
individuals,
could you try
and it's
calling in
throughout
by
LA
phone?
City too. But there's different teams. It's just that we don't have a lot of people.
Yes. No,
Okay, I'm
thank you,
sorry.
Monica. I'm sorry, your
Did
sound
you
quality
hear
is
me now?
really. No, I mean, unfortunately, we hear you for a minute and then it slows down, speeds up, goes wonky. It's just not a clear
Yeah.
connection, unfortunately. So, yeah, I'm so sorry. It's just not working out for you to be participating this way right now. Like
Stop.
there's a recommendation in the chat that maybe you could call in through one of the phone numbers as opposed to logging in through the Zoom app. Maybe that would work better. But anyway, I Ari was your, I think Jorge was, you know, trying to respond to the question in terms of that medical care element, and what kind of levels of medical care are, you know, not just offered up, but maybe even like pushed into the spaces where the homeless encampments are. Jorge, I don't know if you had more to contribute on that point.
Just a couple things. Like Monica was saying, the Exodus outreach team is funded through our hospital, and their job is to go in and around the campus and connect with individuals and offer services. So that's one way. There's also a street medicine team in collaboration with USC that does a lot of medical care and outreach in the surrounding areas. They also do follow-up care for patients who are unhoused, who go back to the streets and require some follow-up care. That street medicine team does that follow-up. And then there's mobile clinics that DHS moves around the city in different areas to provide clinical services to this population.
Yeah, that's right. We haven't talked about the street medicine team in a while, but that was a nice innovation over the last couple of years to really try to meet people where they're at and bring that medical, extend the walls of the medical services of LAC-USC. Any additional questions for Jorge or comments on what we've been discussing? Yeah, and Monica's contributing by the chat, saying that there are teams that go out and engage, but there's not enough resource and not enough teams to meet the need. But just, congratulations on the street medicine team and the efforts that they're able to accomplish. So I know, Jorge, it's a big challenge. And I think to your point, Ari, one other thing that I've noticed with the homeless encampments is access to electricity. That is one thing that they're tapping into. There's outlets around the campus. And so a lot of the individuals that we see are accessing the electricity to charge phones, to charge things like that. So I think that's another kind of attractive element of some of the placements of where people are setting up camp to be able to have access to electricity. And I do agree. I imagine that the safety element would also be very compelling. So, okay. Any final thoughts or comments? All right. If not, thank you again, Jorge, for joining us. We're really looking forward to the first week in May. A lot of exciting stuff coming, and to a beautiful campaign celebrating this incredible facility and all the wonderful work you do with that new identity and brand that kind of resonates with the community that you've been serving for over 100 years. This campus. So very exciting stuff. All right. Thank you, Jorge. All right. So next up, we're very excited to welcome colleagues from our Department of Public Health. They're going to give us some community and campus health updates. This is Ari, Felix, and Dr. Sid Puri. So Felix, there you are. Welcome. I'll let you kick it off. Oops, you're muted, Felix.
Sorry about that. Just as a heads up, I did have to, Dr. Puri's in Boston, so I sent him a heads up. He knows to join, but I think that he's running a little late. But anyway,
got it. Okay.
So hi, everybody. I think Ari's actually going to kick us off.
Okay, great.
Okay. So, all right, well, let me get to my document. Sorry.
Not at all. Would you like to share a screen, Ari?
No, it's just something I need to read.
Got it. Okay.
Okay.
Sorry to interrupt. Heather, did you get the slides?
Yeah, should I go move on, please?
Oh, sure. Yeah, thank you.
Here you go.
Okay, so, bottom line is that part of our discussion in governance and all that was, as things come, we keep hearing on the news about, yet another mass killing. But we also inevitably also hear that the incident is attributed to a mental health status of a perpetrator. This person is usually, this is a particular highlighting topic for us because, just recently, Lunar New Year in Monterey Park, there was a big mass shooting. And then also, there was one prevented the same night, same shooter in Alhambra, which was just, less than a mile from my own home. And, the other aspect of it is that oh, and this was so fresh when we were talking about it, was the incident that happened where Wilson High School student was stabbed in El Sereno, and big manhunt to try to find the person, so on and so forth. A few days later, they find the person, but once again, mental health of the individual is assumed to have played a role. So then we also hear of situations where a sharp increase of unhoused individuals we were just talking about, and part of this is also, we know that a lot of people lost jobs. There's issues around that, but there's also issues around the mental health status of those individuals. And finally, another example of what's happening in our community is families, maybe even medical providers who are identifying individuals who need help for mental health services, but then they don't accept the help. So, the whole point is to try to prevent something bad from for self-harm of that individual and also harm to others. So, that brings us to the issue of what California is doing about it. And so it's launching what they call first in the nation care court. And so I've been hearing about this, and then lo and behold, there was a law passed, I think last summer, and then there was going to be pilot programs happening. And then after the new mayor came in for City of LA, right away, the big issue was the homeless population and doing that. And so part of that effort, then Los Angeles signed up for the care court. So what we wanted to do is bring it to HICP and say, well, wait a minute, we think that this may involve us in terms of community, how our community is affected, and also how the health department, the county, and all its social services are going to be playing a part in this care court. So we wanted to review what that is and so on. So Felix, if you could please help us identify this care court. What the heck is that?
Yeah, absolutely. Thanks, Ari. So, I'm just going to give a quick overview of this new law that was passed. And just as a context setting, mental health is not directly related to violence, right? So I know that we've had a lot of community violence, and mental health has been a factor perhaps in some of it, but people who are struggling with severe mental illness are not inherently violent. But thinking about this law, I think that's one of the things that people have really been spurred, to think through. So in thinking about, so this is called the CARE Act, right? So it stands for Community Assistance, Recovery, and Empowerment. And it's also known as CARE Court or SB 1338, as Ari mentioned. And so the goal of it is to connect somebody who's struggling with untreated mental illness, who we know often have other challenges like substance use or homelessness or justice involvement. And it is aiming to connect these folks with voluntary or court-ordered care plans for up to 24 months. So one thing to note is like assisted outpatient treatment. This is actually a civil court program and not a criminal court program. So the aim of these care plans is to get people who are experiencing severe mental illness into voluntary care with the hopes of preventing or interrupting conservatorship, houselessness, addiction, and or involvement in the justice system. So each of these plans are managed by a care team in the community, and that care team can include clinically prescribed, individualized interventions that have a lot of different supportive services. It can include medication, it can include a housing plan, right? So it's really client-centered. It can also include a public defender and what's being called a care supporter, who's really kind of like a peer or some sort of support who can help the client or the participant make self-directed care decisions. So one thing to note is that Care Court is not for everybody who is experiencing homelessness or mental illness, right? So it's very narrow criteria. It's people over the age of 18 who have undertreated or untreated schizophrenia spectrum or other psychotic disorders, who are meeting specific criteria, right? So it is a pretty narrow criteria. But again, lawmakers are saying that the aim of this is to get people into care before they get arrested and before they might be committed to state hospital or become so ill that they end up being conserved. Okay, so this law is modeled on other examples of courts mandating outcomes for particular issues, so like substance use, mental health, and domestic violence. So for example, the Lanterman and Petrus Short conservatorships or assisted outpatient treatment, which is also known as Laura's Law. So lawmakers are saying that Care Court's going to help people avoid these conservatorships. And unlike conservatorships or Laura's Law, they estimate that it's a time-limited thing, right? So it's generally about 12 months and sometimes 24 months in length. Again, one thing to stress is that this is a voluntary program and it doesn't include institutionalized settings or long-term involuntary medications. However, it is still a court order, right? So if somebody does not opt in voluntarily, there can be a court order. And again, this is a civil court, not a criminal court. One thing that's also different is that a lot of the existing programs like this, these court-ordered programs, can only be initiated by specific people. And kind of one of the hallmarks of the CARE Act and Care Court is that somebody can be referred by a family member, service provider, county behavioral health, first responders, and other organized authorized parties. So one thing that's really interesting about this is that the county government is actually named in the court orders, so along with the participant, right? And this is going to, or not going to, I should say, it is intended to ensure accountability to provide treatment and care. So one thing to note about that in particular is if the county is unable to accommodate a participant's care and housing, there will be a $1,000 per day fine by the courts. So any fines that are paid will then go back to the state in what they're calling an accountability fund. And that accountability fund will be put back into the care of the patients in the program. So in terms of funding, I think we'll get into this on the next slide, but we know we have a lack of housing. We know we have a lack of treatment beds. So the state is saying that there's funding for this care and housing that totals over $27 billion, and sources can include the Mental Health Services Act, Behavioral Health Bridge Housing Program, and earmarked funds from the state that are supposed to address homelessness, and that those funds should be utilized by the counties to create the services to match the need. Can you go to the next slide, please? Thank you. Okay, so the other thing that I want to note real quick is that I'm not an expert on this, and so we're kind of starting this conversation now, and the law has not passed. I work for the county, I work for the public health department. I am not directly involved in the county's implementation of this, but we are going to try and find somebody who has been working on this to come and discuss this further if folks are interested as well. That said, so just a quick timeline of the bill, right? So it was introduced last February 2022. It passed through the Senate, the Assembly. It was signed into law by the governor on September 14th of last year. So the timeline for implementation, right, none of this has started yet. So we are not actually moving in this. This has not started. Nobody has been a participant yet. Originally, there were 7 counties who were going to do early implementation, and they are all set to start October 1st of this year. So as Ari mentioned, LA County was not originally in those 7 counties, but once basically Karen Bass, came into office and decided that, well, I'm sorry, she's not, she's the mayor, but Karen Bass, announced a state of emergency around homelessness, And it was around that point that LA County announced that we would implement early as well. So LA County's implementation timeline has been moved up. It was originally supposed to be December 1st, 2024. And now we're looking at an implementation of December 1st, 2023. So about 8 months from now. So obviously the county, folks in the county are working hard on this. And so it's, we're moving pretty quickly. So this has been a bit of a controversial law. And I just want to go through some of the things that proponents are saying versus things that opponents are saying. So proponents of the new state law are saying that this is something innovative, right? And we have to be innovative and radical because what the state and the counties have been doing up until this point has not been working. And particularly not at the scale that's needed to provide appropriate care for people who are experiencing psychosis due to schizophrenia or other psychotic spectrum disorders. Family members in particular are highly in favor of this law because it will allow them to access referrals for their loved ones rather than having to wait for law enforcement or the courts to do so. And it's also thought that once a person is stabilized by their personal care plan, they will be able to make better choices in directing their own care. So I would be remiss if I didn't mention there is also an active lawsuit against the state in opposition of this law. So some of the high-profile opponents of this law include Disability Rights California, Western Center on Law and Poverty, Public Interest Law Group, and the ACLU. So a big point of contention about the CARE Act is that the law is mandating counties to find housing for program participants. We know that is, we don't have enough housing. No, a lot of places in the state do not have enough housing, but particularly LA County. And so folks are saying that this is going to create further competition for, housing that's already almost non-existent. And this might mean that people who have been waiting for housing could be deprioritized in favor of this program's participants. Right, so another big argument of the opponents is really the basis of this lawsuit, right? And so it is that the CARE Act poses, and this is a quote from one of the amicus briefs, the CARE Act poses unacceptable threats to the civil rights of unhoused Californians living with mental disabilities and will further entrench racial disparities in healthcare and in the criminal, legal, and civil commitment systems. Forced treatment is ineffective and only serves to divert resources away from actual solutions, funding voluntary services and affordable housing. Right, so excuse me, this is, again, the basis of the lawsuit that has been filed against the state. And these organizations are saying that it also further criminalizes mental illness and may likely increase the number of conservatorships in the state. So that's a broad overview, very quick, and kind of the arguments for and against it. There is an active lawsuit. We are, I believe there are folks in LA County, well, I know there are folks in LA County government who are actively working on how this is going to be implemented. And so, if folks are interested in continuing this conversation, we can find some people who are doing that to come in and speak as well. All right, next slide, please. Right. So, oh, go ahead.
I was going to say, I saw we did have one hand raised from Maria Arellano.
Sure. Oh, yeah.
Maria, would you like to ask your question?
Sí, una pregunta. Bueno, es pregunta y comentario. Hay una comunidad muy vulnerable y principalmente durante el tiempo de pandemia, que es personas que están viviendo con un diagnóstico de salud mental y también con una discapacidad, que se encuentran en las calles, que han estado bajo también el sistema penal porque han llegado a parar una cárcel. Personas que no tienen hogar y es doblemente el problema porque no existe quizás este apoyo. Muchos de los casos de estas personas son clientes del centro regional, pero han vivido tanto en el desamparo que ni siquiera en este momento han sido identificados. Existe el departamento DDS, que es el Departamento de Desarrollo y Discapacidad, personas que están viviendo en la calle, también con una discapacidad, pasando por una situación de esquizofrenia, bipolaridad, bueno, infinidad de trastornos de salud mental. ¿Cómo está este apoyo? ¿Cómo se ofrece este apoyo? Porque es una población que podría decirse que es tan invisible, tan vulnerable. ¿Cómo es el apoyo que se le brinda a esta persona? Que aparte de que está viviendo con una situación de salud mental, vive con una discapacidad.
So a reminder to please select the interpretation globe on your icon bar below to be sure that you're getting all of the simultaneous translation between English and Spanish. Felix, were you
I can talk about that or respond, not that it's a direct response, but which the bottom line is that she's asking how can we get help to individuals who need help for mental health, but they also need housing, and then they also have other disabilities and needs. And so I think that that's the intention of the CARE Act, to try to help people, even if they are not able to make decision for themselves before things get really bad. And it also prioritizes them. That's what we're learning about this. And so really consider that this is an effort for the government to do something. And there really aren't any programs that are currently, she's asking for a referral basically. And I'm like, we don't even know what they are because the programs are being developed. And so, but it's also what, I sensed some emotion in her question. And that's the problem that many families are dealing with. We don't know what to do anymore. And so how can this individual be helped? So our intention today is to bring this to this table and to say, you know what, not only is the government responsible, but we also as community should have a say and input and in terms of prioritizing and also how the program is structured. And so we're hoping that we are able to hear more from whichever entity is working on this and other individuals to tell us more about how this is being rolled out in Los Angeles County. And hopefully it can become a program that is successful for our community at large. Did you have anything to add, Felix?
No, I think you covered it. Thank you for that.
Yeah. So our intention is to have this as kind of an introduction, kind of, pull back the veil and say, hey, this is happening. And then, and hopefully be able to invite people who are experts on this to talk to us and inform us about it. And then also for us to hear from, real life cases, individuals who know firsthand what the challenges are. Felix talked a lot about the, who's trying to stop it, but I don't think they're trying to stop helping people. I think they want to protect the civil rights of individuals. And that's of course important. And, but I think, this also ties to issues around the first Care First, Jails Last effort that I know the supervisor's office has been supporting. And so we're interested in learning more about how these things all kind of come together and how our community can benefit from it. And I think certainly, we've been talking a lot about the pandemic and how we had to step up to change things, make new rules, make new law, regulations for the healthy and safety of all. And so this is kind of, it's time for us to pay attention to what's going on in this arena and hopefully it leads to less homelessness, less crime, more safety, and more health in our community. So if you do have any referrals, references, etc., Felix, we have the next slide has articles. You know, some of these articles are this week, LA Times and others. So we're going to be hearing a lot more about this, and so I think it's important for our HICP community to be aware of it and to help inform it as much as possible.
Yeah, thank you guys for being on the cutting edge in terms of introducing these incredibly important issues. As Felix mentioned, this is a statewide initiative where LA County is one of the implementing agencies or spaces, I should say, but it's also a national conversation. And everyone around this table may have heard of other states that are doing similar measures. So it's really being considered more broadly about how do we address the individual that is really struggling and suffering and maybe not in the best place to make decisions for him or herself. And I know we have Dr. Sid Puri with us today to talk also about another one of the kind of issue is in this area, which is substance use and substance use disorder, and how that kind of also is another, kind of community health issue and priority, and how, once again, is the county reaching out to address individuals who are struggling with that particular condition. So Dr. Puri, welcome.
Hey, yeah, thanks so much for having me. Sorry, my computer's about to die, so I'm running in to plug it in. That would be great. Yeah, thanks so much for having me. So I'm joining you all from SAPC, which is the Substance Abuse Prevention and Control Division of Public Health. And we focus on minimizing either people initiating drug use or minimizing consequences from drug use. So we're very much into both prevention, harm reduction, and treatment. I wanted to spend some time talking about xylazine today, which has been making a lot of rounds in the news and is a new kind of adulterant that we're finding in our illicit drug supply. Before I start, has anyone heard of xylazine? Maybe you could say yes or give me a thumbs up. And in the chat, if you have heard of it, maybe tell me a little bit about what you know about it.
Yeah, we have Hugo saying yes, he has heard of it.
Perfect,
I know
Hugo.
personally, yeah. I haven't, and this is part of an ongoing conversation, Dr. Puri, where we were talking about fentanyl and the adulteration of fentanyl in other drugs that people were taking and having such, adverse reactions. So this is kind of the next level of, I think, what's happening in the community. So exactly. Thank you for, bringing this issue very forward.
And just to give you an overview, so fentanyl is an illicit, fentanyl is both a prescribed but also illicit opioid. It's killing people now in the illicit form. So we are seeing fentanyl kind of being laced into pills, powders, even medications coming from non-US pharmacies can have fentanyl in them. So it's really important to remember to only take pills and prescriptions that are prescribed to you by a US physician from a US pharmacy. And if you're going to kind of engage in any illicit substance use, please test your substances for fentanyl. There are fentanyl testing strips that are cheaply and widely available online that can save someone's life. And then make sure you have naloxone. To kind of give you another scare of the other monster in the room. So xylazine is another adulterant that we've been seeing moving west. And so it's actually an animal sedative. And so veterinarians use this medication to sedate large animals like cows, elephants, giraffes, hippos, things that you'll see in a zoo, basically, because it helps them to calm them enough to do surgery on them. So that's where xylazine comes from. They tried to understand if it could be useful in humans. And when they were doing tests on humans, they found that it lowered their blood pressure and their heart rate to dangerous levels. So the FDA banned it in human use and said it was only appropriate for these large animals. Back in 2008, we started seeing a lot of the xylazine being cut into illicit opioids like fentanyl and heroin on the East Coast. So right now, cities like Philadelphia, New York, DC are kind of ravaged by xylazine. The reason we think xylazine is being cut into the illicit heroin and fentanyl is because the way that it works in the body is not like an opioid. So it's not like a fentanyl or heroin. It works by decreasing blood pressure and respiratory rate. But when it's combined with an opioid like fentanyl or heroin, it can prolong the high of heroin or fentanyl. So make them high for longer, make them feel kind of like out of it for longer. So it's a cheap way, it's very, very cheap to get, a cheap way of kind of like making someone's high enhanced or more intense. The problem is, in doing so, it increases rates of really deadly and scary overdoses, because fentanyl and heroin, if you take too much of it, can stop your breathing. When you combine it with another substance that lowers heart rate and lowers breathing, it means that you're at an even higher risk for overdose and death. So we were kind of like last year when xylazine was getting much more news play on the East Coast. Part of me was like, is it going to move west? Like, it seems to be very concentrated in the East Coast right now. And we have really good evidence that it's actually here, and it's in Los Angeles County. Back in February, there were 3 deaths associated with xylazine in San Francisco. There was 1 death associated with xylazine in 2021 in LA County. And here we're seeing, again, with our fentanyl overdoses, the coroner is testing a lot of these bodies to see if there's xylazine presence in them, and we're waiting on that data. But from testing data we have from the LA sheriffs, from the Orange County sheriffs, they are testing samples of illicit substances that do contain xylazine. So we know it's here. So now what do? Unlike an opioid, which we all know is reversed with a magical reversal medication called naloxone, which kicks the opioid off the receptor, allows someone to breathe again. Because it only works for opioids, it's not going to work for xylazine, which is scary. However, if someone's using an opioid, they have an overdose, and if xylazine is also present, the naloxone will still work on the opioid part of that overdose. So say I've mixed my fentanyl with my xylazine and I overdose, and you're like, but Sid said naloxone doesn't work for xylazine, but naloxone will still work for the fentanyl part of what's in my body. And that may be enough to get me breathing again. The main point in an overdose of survival is getting someone to breathe again, getting oxygen to their brain. Because when we don't have oxygen in our brain, within 3 to 5 minutes, tissue both in our brain and in our body start to die. So we need to get oxygen. We need to restore their breathing as quickly as possible. So the way we're kind of talking about xylazine now is that we want to make sure people are aware that it's likely in our illicit drug supply. There isn't currently an antidote to it like naloxone, but you should still use naloxone in cases where you're suspecting an overdose. Like fentanyl test strips, there are xylazine test strips. So they're also cheaply and widely available online. They just came out about a month ago. So you can purchase them online if you're going to use, or if you have community members who are using. It's a very simple test, very similar to the fentanyl test strip, where you crush up the substance, mix it in with a bunch of water, and then dip the testing strip in it, lay it on a flat surface for 5 minutes, and you'll be able to see if it's positive or negative. Like the fentanyl test strip, the xylazine test strip doesn't tell you the purity of the xylazine, the potency of it, or how much is in it. It'll just say yes or no, but it doesn't say like, oh, this is 90% of your sample, or this is very pure, high concentration xylazine. So keep that in mind, but it's another tool that can prevent overdoses and deaths. In terms of naloxone, we want to make sure everyone has naloxone. I saw Greg put in the chat that the FDA did approve for over-the-counter naloxone. So that's approved now, which is wonderful. We're waiting to see what will happen in the fall in terms of how much it's going to cost. So on the one hand, over-the-counter naloxone will decrease kind of like, it will increase access to it, right? Because it'll make people buy it kind of just like they're buying Benadryl or anything else over the counter that can save someone's life. We're waiting to see how much it'll cost, because I think that's going to be possibly prohibitive to our higher risk community members, especially those who are, experiencing homelessness or using drugs on the street. They may not be able to afford naloxone for like $60 or $80. So we're waiting to see kind of how that comes off. I know our governor said that he was going to employ another pharmaceutical company in California to make naloxone for the state, just as he was trying to make insulin for the state. So that could also drive prices down further, but we're waiting on that. So it will be available over the counter, likely in the fall, and we're still waiting on kind of like how much it'll cost. But we're hoping that as it's available over the counter and as more generics come out, hopefully that competition will drive price down and increase access overall.
Okay, thank you so much, Sid.
For
So
sure.
yeah, a lot going on in public health these days, of course, and these are all, I think, such important issues, such kind of crisis point issues in our community, both in terms of, home, like the series of issues we've talked about today, homelessness, mental health crisis, and now and the intersectionality between mental health and crime and violence, and then of course now we've got the substance use disorder. So a lot of really painful and difficult issues that we're bringing forward to address here. So we really want to create this table and space here at HICP to be responsive to the questions and the concerns that you feel about how is your community experiencing health and wellness and opportunity across LA County, and how can we drive towards better solutions and better service and care for our community. I do see a hand raised from Greg Bonet. Greg, welcome.
Thanks. Yeah, I'll be brief. Thanks for that information about the over-the-counter naloxone. So right now, if we have employer-provided health insurance, is the best way to just ask our primary care provider for a prescription and fill it through? Okay. Yeah.
Yeah, for sure.
Great. Any other questions for Dr. Puri? Any other questions for, as mentioned, Felix and Ari, thank you guys so much for setting the table with that incredible kind of teaser to the breaking news about this this new Care Court and the new Care Act initiative. And I think, Ari, as you said, really bringing this information to this table so that people around this table can know what's coming and seek to be advocates and participants in the work as needed. So any questions for any of our three fabulous speakers on this topic?
Yeah, I just wanted to highlight that the links, when you get the PowerPoint, these links are hyperlinked to articles. And then I think we're going to try to put those in the chat as well so that people can have those sooner.
Yeah, perfect.
Yeah, but just look in the newspaper and you'll find some articles about it, I tell you.
Yep, no, absolutely. And like I say, this is very exciting to have both Dr. Puri, you, Ari, and Felix really bringing, like I say, the breaking news and bringing, an expertise and a consideration to these topics that we see in the LA Times and other newspapers, every day. So thank you all so much for spending some time with us today and talking about these really critical issues. Very much appreciated. Okay.
Thanks for having me. Bye.
All right. Enjoy your time in Boston, Sid.
Bye.
Bye. Okay. Well, if no more on those particular topics, we'll move along. We're super excited, as always, to have our colleagues from Century here to give us another update on the wonderful Restorative Care Village Permanent Supportive Housing Project. Speaking about the intersection of all of these issues and space and place on our campus to help serve our community in their highest needs. Here we have Gilbert and Oscar to talk us through it. So I'll stop sharing so you can go ahead and take it on, if that's okay.
Yes. Heather, can you hear me? Can everyone hear me?
I can hear you fine.
Okay, great. Let me go ahead and share my screen, and let me just confirm that you all are seeing the presentation. Do you see the presentation screen?
I sure do. Looks great.
Okay, and then let me see if I can do one more thing. Okay, so this is going to be a highly visual presentation. So hopefully you can be in front of a computer. If not, of course, the presentations are recorded. And so you could always go back and see the visuals afterwards. I'm also have a lot of material to cover. I'm gonna rush through it. If it seems like I'm going through too quickly, let me know, I can slow down. But the purpose of rushing through it is trying to get through all the material and then leaving time for questions, okay? So I'm presenting on the project that we're calling, this is a placeholder name until we come up with an official name down the road through a community engagement process. But for now, we're referring to the project as Century plus Restorative Care Village Permanent Supportive Housing, which is what PSH stands for. Let me go. There we go. So I was asked to speak on 4 topics today.
So I'm going to start with the design and amenities of the project. Our goal with our design that our conceptual design that we are currently presenting to the community and getting feedback on was to maximize the use of this site. So right now this is a vacant site. We are attempting to put all of these different things on this site: 300 apartment homes, 150 parking spaces, a 12-bed peer respite program, workforce development kitchen, cafe and retail, extensive landscaping space for the community, prominent opportunities for community art, mobility improvements, and a multimodal plaza. And we'll look at each of these in detail, but just to make the point that there's a whole lot that we're trying to fit on this particular site here. These are some initial design renderings that we developed for our proposal to the county a little bit over a year ago. You can see that there's actually two different buildings, and we're going to talk about this a little bit later, but there's a building to the front of the screen, which would be at the corner of Griffin and Mission. And then there's a building that's further back, which is adjacent to the railroad tracks, which are behind the building. So I'm going to run through some renderings. These are some of the inside renderings. As I mentioned, extensive landscaping space. That landscaping space is located on the ground floor and on the second floor. This is another far view. You can see the multimodal plaza in view there. These are some more renderings. This is on the ground floor. You can see the second floor up above there with more open space. And this is also on the ground floor. And you can see kind of a grand staircase leading up to the second floor outdoor space. And then one last design rendering, again, the multimodal plaza. I'm going to talk about the design and amenities for residents. So again, I mentioned two buildings. So building one is adjacent to the train tracks, the building that's further back. If you can see my cursor, it's over that building. With that building, we have 67 studio units that will be permanent supportive housing. And I'm going to explain a little bit more about what that means, but just to give an overview for now: 67 studio units, permanent supportive housing, and 8 one-bedroom units for permanent supportive housing, as well as 24 studio units, affordable housing, and 50 one-bedroom units for affordable housing. And again, I'll also get into breaking down what affordable means in just a little bit. And then 1 two-bedroom unit for the property manager. So in total, building one will have 150 units. Building two, which is at the corner of Griffin and Mission, will also have 150 total units, 60 studio units for senior permanent supportive housing, 15 one-bedroom units for permanent supportive housing, 60 studio units for senior affordable, 14 one-bedroom units for senior affordable, and 1 two-bedroom unit for property manager. In addition to the units, which again we'll look at in just a little bit, I know I went over that quickly, we have these amenities and these services for residents. So amenities for residents: community room, laundry rooms, an exercise room, a computer room, garden galleries, roof garden, a dog park, a basketball court, parking, bicycle parking, and a bicycle repair facility. These amenities are available in each of the 2 buildings. So it's not like they have to share between buildings. That's except for some of these at the bottom, like the bicycle repair or the basketball court. That is shared. Services for residents will include property management office and on-site property manager. A property manager, we will have 2 of them for this site. One will live in each building. Each building will have 5 case managers, 3 of them intensive case management case managers. There will be a sensory therapy room, a wellness studio, and plenty of therapeutic garden space, some of which you saw on the ground floor and on the second floor. So these are all services and amenities for residents. Now I want to go back to the amenities for the community, and going back to that list of things that we tried to fit on the site. So there's a 12-bed peer respite program. We definitely see connections to phase 1 of the restorative care village, the buildings that are already in service. This would be, as Heather just used the term, a step-down program for up to 12 individuals to stay for 2 to 4 weeks. Approximately, I'm sure exceptions can be made for longer stays or shorter stays. This is going to be on the second floor of the development. We also are going to have a workforce development kitchen, cafe, and retail. This will be on the ground floor. There's some background noise. I'm not sure if we can mute that. This is a workforce development space on the ground floor. Again, it'll be opportunities for community members, including possibly residents, but also open to the broader community to have workforce development opportunities and food preparation, food service, and food retail. And the cafe, which is located here in the front, will be on the ground floor in that nice plaza area right at the corner, right at the intersection of Mission and Griffin. Extensive landscaped outdoor space is available to the community. You know, we had a really unique design on this project where we used piers to be able to open up the ground floor space and create a lot of outdoor space there. You can see in some of these images the fact that the second floor is off of the ground floor, allowing for walkable open space. On the ground floor, we have 27,000 square feet of open space, and on the second floor, we have 38,000 square feet of open space. This space is accessible to the community. This is an overview of the site, but there's kind of the buildings are made transparent, so you can see that underneath the buildings, I mentioned that pier situation, there's a lot of green and a lot of landscaping and a lot of opportunities to walk and to sit and to socialize. 66% of the site is left for open space, which is, I think, a really unique situation and design that we went for with this. Other amenities include prominent opportunities for community art. Potential areas include garden galleries located in Mission and Griffin intersection and along Mission Road. So these cutouts, these very large prominent cutouts in the building, are what we're referring to as garden galleries. You can kind of see up close that they provide two things. They provide an opportunity for again, prominent community art. They also provide opportunities for plants and then for use by the residents. So these would be used by the residents, an opportunity for them to be in this amazing environment, but obviously the murals would be, or the art would be so prominent that it would be visible to the community passing by. I mentioned mobility improvements to the sidewalks, streets, and intersection. This is something that we still have to get feedback on from the community and also agree to with the city, since this would be taking place on city property. But there is funding that we can get, that we will be applying for, that will help us to make various improvements. Some of those improvements that we've identified are, these are kind of the technical drawings. Let me show you what these would look like. You can see bike lanes along, well, actually, I think this exists already. So bike lanes along Griffin, improvements to the intersection. This is the intersection that connects to the Restorative Care Village, LAC USC Medical Center campus. Enhanced lighting and this multimodal plaza, which let me describe here. So this multimodal plaza would be an opportunity for shuttles, possibly buses, and also ride share, whether it's somebody just giving their daughter or son a ride, or whoever they know, or like an Uber or that kind of rideshare situation. But this is a carve out. This is technically a street called East Lake, and this is an opportunity for people to come and drop folks off, again, whether it be a shuttle or a bus. And that provides access to our site with all of the amenities that I just went over, but also that connection point to the campus. So at times, perhaps people want to get to that particular side of the campus, and this would be an accessible way to do it. As you know, with that area, it's otherwise not too accessible, that particular intersection. Here you can see some images of the multimodal plaza in play right in front of you. So it would be this carve out here. Just to wrap up on design, I'm definitely not going to go over all of this, but just to make the point, we've presented this in previous presentations. With our design, we really based it, and our amenities, we really based it around connecting to all the different focus areas of HICP. We also really put thought into connecting it to the restorative care village and having the different programming spaces and services that we designed there in alignment with the restorative care village and the work that it's doing there. We've last thing I'll mention is we have begun to engage the community in different ways. So we've given a couple of presentations to this group, the HICP meeting we presented on design back on December 2nd. You could of course go back and look at the recordings of these if you're interested. And then something I'll talk about in a little while, which is the HICP subcommittee. We've had a primary discussion with them in mid-February. And then something that is upcoming, if any HICP subcommittee members are on this call, you have not heard about this yet. We've had some delays in moving this forward, but in preparation for some upcoming in-person community workshops, we're going to be previewing our workshop approach and materials to the HICP subcommittee. And then I mentioned those in-person meetings. These are draft flyers. Again, we've had some delays with finalizing this, but we will be holding 2 in-person community meetings. We were aiming for the end of April. We're still aiming for that. One would be on Thursday, April 27th in the evening. One meeting would be Saturday, April 29th in the morning. One meeting would be located in Lincoln Heights, and one meeting would be located in Boyle Heights. And these meetings would be 2 hours long, and they would be designed to get feedback from the community about the design that we just looked at. We've got some feedback already from our HICP subcommittee. We've collected that feedback. We're going to wait until we collect this additional feedback and then look to make adjustments to the design with our architects. Okay, residents, rents, and subsidies. I just want to remind folks the context for this development. We are technically phase 2 of the restorative care village. Heather just spoke to the idea of a continuum of care. This phase, this is an early rendering of the idea of the restorative care village. This particular site, was intended for as a health resource for the community, and also for permanent supportive housing. One of those steps, as Heather mentioned, in the continuum of care. That was incorporated into the RFP that the county put out and that we applied to. The focus was on permanent supportive housing. Just a quick overview of what permanent supportive housing is. This is a really good definition. Permanent supportive housing is an intervention that combines affordable housing assistance with voluntary support services to address the needs of chronically homeless people. Some of the key components of permanent supportive housing, typically studio or 1 bedrooms. There of course are some larger household situations that have more people, but primarily these are individuals or or smaller households, perhaps a couple. And so usually studios and one bedrooms are the focus for permanent supportive housing. A rental subsidy is required because, of course, there's limited ability to pay rent. Intensive case management services to help the tenants be stable in life and in their ability to be in their home and be at the development. Other supportive services and supportive property management. Property management still has to perform the functions of a property manager, including collecting rent, but there are approaches that can be more helpful and accommodating for a permanent supportive housing kind of situation. We have Century will be doing our own resident services and property management. We have extensive experience with this, very successful experience we've talked about in previous presentations. I won't go on about it. And I also won't kind of go over this, but just to say that we put a lot of thought and care into our approach to permanent supportive housing and providing the support and the services that are necessary to make those situations thrive and to allow those tenants to be successful living in place and to allow them to successfully integrate into whichever communities they are a part of. So now into the details of the buildings. So as I mentioned, building one, I've given these details on the breakdown of building one already. Building one, again, is the back building adjacent to the train tracks. This is who will be living in building one. So the unit set asides for building one, again, 75 permanent supportive housing units. Those will be homeless individuals with a mental illness. The maximum income amount would be 30% AMI. And they will be leased up through the coordinated entry system. So you all, I'm sure, are familiar with that, given this group. This building will also have 74 affordable units. These will be for individuals and small families. Again, we're talking about studios and one bedrooms. One bedrooms can accommodate up to 3 people. And so these will be for individuals and small families at 30 to 60% AMI. The leasing method here will be outreach and marketing. Marketing is traditional, but outreach, in terms of the connections that we have to connect to local people in the area and groups that we are connected with. I think on our call recently with an HICP subcommittee, this came up. We had good representation from the Eastside Leads group, and they had asked about lease up, and I mentioned that that's exactly the kind of outreach that we would do leading up to the lease up of the building to make sure that that the folks that they work with know about this opportunity and are ready for it. And then the one property manager unit. Below are the affordability levels. These are levels that are given to us by the state tax credit authority. Tax credits are where we get at least 50% of the money to develop these developments, and that's the standard that we have to work by. So I mentioned 30 to 60% AMI. These are what those percentages translate to. This is the maximum threshold. So if a person makes more than this, they would not be eligible for these 74 affordable units. And then this is just I mentioned TCAC gives us these numbers, and this is the source for that. You don't have to look at the top again. The top is just a repeat. The bottom, though, gives you the rent levels. So the rent levels for a 30, a 40, a 50, and a 60% AMI unit, whichever it's set aside at. If it's a studio, it would be these rents. And if it's a 1-bedroom, it would be these rents, so slightly more for the 1-bedrooms. You would subtract what's called a utility allowance from each of these rents. So $66 for the 1-bedroom, you would for the studio, you would subtract from the $625, and then $85 allowance for the 1-bedroom, you would subtract from the $670. So the rent we would collect, or the building would collect, would be $670 minus $85. That's what the tenant would be responsible for paying. Again, these are also coming from the California Tax Credit Allocation Committee in terms of what those rents are. And in terms of the utility allowance, which I just mentioned, that comes from the county. The final slide for building 1 is the rental subsidy. The rental subsidy only applies to the 75 permanent supportive housing units. Those are the only units that we have a voucher for, a rental subsidy for. We do not have rental subsidy for the affordable units. So the affordable units will be, they will be responsible for paying these rents. The supportive units, the PSH units, obviously there's limited or no ability to pay rent. And so those units are covered by the county, and the county is able to pay for a studio at $1,840 and for a 1-bedroom at $2,096. These this is where these figures come from for the vouchers, and so that's how the voucher program works. I'll go even quicker over building 2. Building 2 is a little bit different in that it's directed at seniors. So it still has permanent supportive housing, but that's directed at seniors, and it still has affordable units, but that's directed at seniors. Everything else is the same. So 1 building is restricted to seniors, permanent supportive and affordable. 1 building is not, so open to others in the community. And this is just a repeat of everything we looked at before. Again, the only real difference is the senior restriction. Community engagement. So we have our community engagement plan. We arrived at this in consult. Well, I think I have that on a future slide. So let me just go in order here. So our community engagement team includes us, Century Housing, as a project developer. So we're coordinating the team. Our primary outreach consultant is Urban Semillas, and our radical hospitality specialist, hopefully I get a chance to talk about that a little bit more, is Heart Forward. So this is an overview of Century as a project developer. This is an overview of Urban Semillas. The HICP subcommittee on community, and we had a meeting on community engagement back, I think, on March 1st. And if anybody's interested, we can provide a recording of that. And we really got into the details of this community engagement approach. And then radical hospitality is Carrie Morrison. Just a quick overview. I'm not, of course, going to go into all of this, but with our approach to community engagement in this plan, we did try to align it with the HICP, goals and focus areas. This is our outreach timeline. So this is, our primary outreach is going to be this year through the end of the year. And this is what that timeline looks like. We have, I mentioned, 2 community design meetings coming up at the end of April. Possibly we may have to push into early May. We're trying to finalize that today. And then we'll have a 3rd meeting a little bit later in the year. We will be conducting a survey. And then we'll be also doing a lot of outreach, not only to HICP, but to others in the community, neighborhood councils. We're meeting with CD14 next week. Of course, we've always been in close contact with the county, given that this wasn't a county award. But also we'll be meeting with neighborhood councils and other community groups throughout the rest of the year. I mentioned our design workshops, which are coming up. Also, you may know that we formed a HICP subcommittee. So this is kind of an overview of people that have engaged and participated to date. We announced this subcommittee over a few different meetings, and we were able to get, I think, a really good group. These are some of the different topics that we plan to cover as we continue through the year. To date, we've had 2 primary meetings, one to discuss design, which was on February 15th, and one to discuss our community outreach plan, which was on March 1st. And then, as I mentioned, anticipated to happen soon will be a meeting where we run through with our subcommittee group what we plan to do at the in-person community workshops to get their feedback before we present those in person. Okay, last slide, our timeline. So up top, you can see in 2022, we were selected for this project. By the end of the year, we had an agreement with the county. ENA stands for Exclusive Negotiating Agreement. And we started to do some initial outreach. I mentioned the presentations we had given to this group last year. This year is focused on community outreach. This timeline, that outreach timeline I just went over, that's what is meant here. So this timeline down here is this here. Oh, nope. Oh, okay. We're also doing, focusing on getting our entitlements for the project this year and beginning to apply for financing. Next year will be all about the financing. We have 7 different funding programs that we need to apply for and win to be able to fund this project, to fund the 2 buildings together, the project. In 2025, the first half of the year, we would close on that financing and we would start construction mid-year. And so the second half, we would be in construction. Construction for this project would be 2 years. So we would start summer 2025, 2026, we would be in construction the full year. And then through summer 2027, we would complete construction. Beginning in summer 2027, we would begin to lease lease up the 300 units. The last thing I'll mention is after this year of focused, intensive community outreach, a few additional moments where we'll be focused on reaching out to this group and to the broader community are to give you updates on the financing applications, just so you know how things are going. Hopefully we're successful, but if not in any of those applications, there may be delays to the timeline. We're gonna be in touch to let you know about construction starting, and so you're aware of that. That'll be in 2025. In 2026, we would be giving you updates on construction progress, perhaps quarterly. And then very importantly, in 2027, we would be in touch leading up to the lease-up period. So as I mentioned, we can let this group and groups that are important to communicate with, let them know about the lease-up opportunity. So that would probably begin in the very beginning of 2027, anticipating maybe like a spring opening, or late spring, early summer opening for that lease-up opportunity. Okay, I think I've been talking a long time. Heather, I'll turn it back to you. Thank you. Let me finish sharing this.
Thank you so much, Gilbert. Do we have any questions or kind of comments for Gilbert's thorough presentation today? Thank you so much for all that great detail. It's very exciting, and we really appreciate how transparent you are with this body about your process and kind of where we are, and just making sure that the community is really engaged and step by step alongside you in this work. Ari.
Yeah, I was wondering if there is an official definition of multimodal. Yeah, it's not just adding a bike lane outside, I hope.
No, so the street improvement, so there's 2 different concepts in play. The street improvement, street intersection improvements. So that will be improvements to the intersection, the lighting, the way the crosswalk works, the markings on the street, the nature of the type of crosswalk. So those are improvements there. You know, I think I'm not sure, but if there are sidewalk improvements that need to be done in terms of leveling the sidewalk, making it more accessible, bike lanes are one of those improvements as well. Too close. Okay. So those are the mobility improvements. The multimodal plaza. So we say multimodal because it's that's more of a vehicle plaza. You know, that's that kind of side street cutout, and that can be any type of vehicle. I guess it could also be bike, but it's really for people dropping off other people in a bus, in a car. And it's a drop off, you know, and so multimodal, I think, primarily refers to the fact that it can be used for many different types of transportation vehicles. Does that clarify things?
Yes, that's helpful. Thank you.
And we have a hand raised from Monica. Monica.
Hi, I did hear, I know that you're talking to Councilmember De Leon's office, but I just want to make sure that we're reaching out to Councilmember Eunices. That's the other side, like, of Lincoln Heights. She's also the council member there. But again, if you don't have a contact, I know her personally and I have contacts in her office, so we can also reach out to that office because that's just on the other side of the building.
That's a good point. Yes, Monica. We'll take you up on that. I know I know Miguel has been in touch, and so we'll definitely follow up on that. We had thought about that too. We just didn't have the opportunity to follow up on that yet. And I'm focused here trying to bring up the multimodal plaza that that Teresa just asked about. But in the meantime, any other questions? No other questions? Okay, I'll just share my screen again very, very briefly. So I think it was Teresa that asked that question.
It was Ari.
Ari, okay. So this is the multimodal plaza here. And again, this main road is Mission, and as you know, there's no real opportunity to drop people off on Mission. But this kind of side street, which is technically a street, it's called East Lake, would be what we would use as that multimodal path. And then the plaza area would be this kind of, you know, we'd have nice seating, we'd have it open and welcoming. But this would be an opportunity here to, again, to have shuttles come through. I think there's a shuttle with the campus that, you know, ideally we would connect to. Bus lanes, you know, those require a whole different level of coordination with the city. So I'm not sure if that is a potential, but that would be another opportunity. And then also just cars, you know, again, whether it's people dropping off friends, family, or Uber kind of situations. But then you could also have, you know, bikes coming through here as well. So that's the multimodal plaza there.
Great, thank you. Any final questions for Gilbert? Okay. All right.
This is Ari. Sorry, I was going to say, I'm actually walking in San Francisco, so I'm seeing all the multimodal right in front of me. And one of the things is the you know, kind of like the bike share stations. So I know that that has to be coordinated with MTA as well and the city. So maybe something like that would also be helpful.
Yeah. Oh, and the one thing I did forget to mention is 2 resources. Are you able to see my screen, Heather? Last thing
Yeah.
Yeah. Okay. So right here are a series of bike stands. I'm not sure if bike share program or, you know, of what Ari just mentioned is possible, but whether it is or not, we would have a series of bike stands here. And then nearby too, there would be a bike repair kind of facility, which would be open to people being able to get their bikes repaired or take their bikes in to repair it, whatever it may be.
Great.
Thank you.
Well, thanks again, Gilbert. Really appreciating your time today. I'm going to go ahead and take back over sharing screen. We've just got a couple more quick updates for everyone that we want to make sure you're aware of. The first is just another kind of continuous update on the General Hospital West Campus request for proposals. As we know, the process is underway, and the RFP was released on January 25th. It is available on the DEO website, as well as several different addendums that have been released through the process. So if you're interested in kind of seeing the latest and greatest, we always point you to the doingbusiness.lacounty.gov website. And if you search for Centennial, because that's the name of the project, the Centennial Project, you will find all of the released information on the project. Where we are in the timeline. So we've been through the site walks of all the interested developers, and today is the day that will the release of answers to questions that have been submitted to the DEO's office. That will be released today. So once again, we'll have some really fresh information for you at our next meeting of HICP on May 5th. So we'll bring forward some highlights of the release of the addendum at the May 5th meeting. Of course, this is kind of one of the final stages of the process for the potential proposers. And then the proposal submission deadline is coming up very quickly on June 2nd. Where are we in the process from a community engagement perspective? As mentioned, the release of the addendum is happening today. That is to respond to questions received from developers as well as other stakeholders, including some community groups. So that addendum release will be in response to the questions raised throughout the process. We're also just getting started in the creation of the evaluation advisory groups, including one of which will be dedicated to looking at the community benefits portion of the proposals. That whole process is just getting formalized now. We will be making a much more thorough announcement at our May 5th meeting, and that will be the time we open the opportunity for people to participate as a member of the evaluation advisory group for community benefits. So that process will be announced at our May 5th meeting, not May 3rd. And then the advisory group that is seated, they will start having meetings in late May, and then we'll receive copies of the proposals for review for about a 3-week period in June, with final reports back to the evaluation committee by early July. So it's going to be a very tight timeline once we get the formal pieces in place, and we're very excited to open up that opportunity to members of the Health Innovation Community Partnership to join. So like I say, we will be doing a much more thorough announcement, both via email and in person, or not in person, but via Zoom at our meeting on May 5th. So stay tuned. We're just ready to kick off that entire process, which is very exciting. We have a few quick little announcements for you before we wrap up our time together. We wanted to let you know about some of the happenings at the Wellness Center on the LAC-USC Medical Center campus. The first is that April is Sexual Assault Awareness Month. We're very delighted to support the efforts of our partner at the East Los Angeles Women's Center, who has an entire month of activities really acknowledging sexual assault awareness and really taking a huge stride in bringing this issue to the forefront and making sure that we are kind of embracing the survivors of sexual assault throughout the month of April. We have a couple events. One of them is Hoops on Invincible, which is really celebrating women's rights to dress as they choose and to be free from assault and violence. And then there's another event coming up, Denim Day, which is on Wednesday, April 26th, where everyone is invited to practice solidarity and support survivors. It's a campaign again about just supporting survivors of sexual assault. So those are two of our events coming up in April. And then we also wanted to mention Diabetes Day. This is an annual event that used to be hosted at the Wellness Center prior to pandemic every single year, but we're doing it back again in person on Tuesday, May 9th. It is a half-day seminar style program from 12:30 to 3:30 at the Wellness Center. And we invite and encourage anyone who is interested in learning more about diabetes prevention and management to please join us at the Wellness Center on May 9th. Finally, we wanted to make everyone aware of an opportunity through LA Repair. There are funds available to be invested in the community of Boyle Heights, and Boyle Heights residents, People who reside, work, and or go to school in Boyle Heights are invited to help select the winning proposals for this special funding opportunity. So $775,000 are going to be invested in the community of Boyle Heights. And once again, the residents and those who live and work and study in the community are eligible to vote to select what are the proposals that they would most like to see funded. You can vote online. You can also vote in person. There's 2 in-person voting opportunities. One is this Saturday, April 15th. It will also be reoccurring on Saturday, April 29th at the Hollenbeck Park Recreation Room. And in-person voting is open starting at 11 a.m. You can see here 6 of the proposals that are eligible for being voted upon. There's really exciting things happening in the community, and this is your opportunity to help select and direct funding to one of these proposals. So we encourage you to take advantage of this opportunity. I'll make sure we put a link to the LA Repair site in the chat right now. And I think that's pretty much everything we have to discuss and share with you today. So very excited for you to join us again, really appreciating your time. And our next meeting will be on the 5th of May. So looking forward to seeing you all in a month's time. And with that, I'm happy to conclude today's April meeting. Any final thoughts or comments, anyone? All right. With that, we'll say goodbye. Have a wonderful weekend, everybody.